Hello, my name is Shamira Perera, and I'm a senior consultant at the Glaucoma service at Singapore National Eye Centre. I'll be speaking today about the sustained-release medications for glaucoma and their uses in the future. These will attempt to circumvent some of the problems we have with our topical medications already. Non-adherence to treatment regimens is endemic in glaucoma and associated with worse visual outcomes and increased overall healthcare costs. Barriers to adherence to topical glaucoma medications include forgetfulness, difficulty in instilling eye drops, and dosing frequency. The lack of understanding of the disease, the medication costs, and side effects also contribute to this. Sustained-release drug delivery has the potential to overcome barriers and provide long-term IOP lowering without the need for topical administration. Adverse effects caused by drug and/or preservative exposure to the ocular surface and surrounding tissues may also be minimised. We conducted a questionnaire survey on the preference of sustained glaucoma drug delivery systems by the Singaporean Chinese subjects as a way of expanded market research. We found that there were certain characteristics that favoured those that wanted to have these slow-release medications. Those were factors such as being male, non-subsidised, and having bilaterally affected eyes with glaucoma. The majority of patients accepted the three routes of alternatives to eye drops. We found that the patients were knowledgeable and were able to judge the link between effectiveness, invasive nature of the application, and also the side effects. The first of these intracameral implants I'll be going into is the bimatoprost intracameral device from Allergan. In their recent studies, a single implant was able to control the IOP up to 16 weeks in 91% of patients. This is a biodegradable implant that's placed into the anterior chamber by a single-use applicator. And the actual rod-shaped device sits in the anterior chamber, attached to the iris but not affecting the endothelium. At all dose strengths in a recent study compared to topical bimatoprost, it was able to achieve a similar IOP lowering. The periorbital fat atrophy is one feature that is frequently noted with topical bimatoprost, and this has been circumvented with the intracameral administration. Also, the typical side effects of conjunctival hyperemia and the growth of eyelashes were markedly reduced in the group taking the bimatoprost slow release compared to the group taking the topical drops. Next, we have the N515 from Envisia. This is a biodegradable polymer drug delivery system that uses an extended release formulation of travoprost. The low dosage form of N515, administered on day 1, achieved the interim efficacy endpoint in their 3-month analysis, where it was able to have an IOP lowering of around about 27%, which was similar to that achieved with timolol dosing at twice a day. The Ocular Therapeutics travoprost punctal plug is a rod-shaped, dried polyethylene glycol-based hydrogel. In our study, we looked at the slow release over 1 month and the retention, and it was able to achieve an IOP lowering of around about 6 millimeters of mercury. The metatherapeutic device, the latanoprost punctal plug delivery system, was able to achieve a 20% IOP reduction at 12 weeks, and more recent iterations of the device have shown improved retention. This resembles a more similar design to the traditional punctal plugs, and if it causes any problems, it can be plucked out as opposed to flushed through with the Ocular Therapeutics device. The TODDD from Amorphous Therapeutics stands for the Topical Ocular Drug Delivery Device. This is a much larger device than some of the other implants that have been used and can store a significant amount of drug. This is stored under the upper lid and, interestingly, in a completely novel way, can be used to store multiple drugs and not just one. Nanoliposomes have been used as a drug carrier for glaucoma medications. These consist of hydrophilic molecules in the core and hydrophobic molecules in the shell. Lipolat from Peregrine Ophthalmics utilizes these and delivers a subconjunctival injection of 100 microliters of liposomal latanoprost. This has had some success in first-in-man studies of reducing the IOP by 9 millimeters of mercury over 90 days. The Helios implant from Foresight Vision is a bimatoprost-laden polymer matrix insert embedded in a compliant ring. This needs to be replaced by a physician every 6 months. In the 130-patient phase 2 trial, it showed some inferiority compared to timolol drops dosed twice a day. Both groups showed a retention rate of 89%. The control arm had a placebo ring and the drops, whereas the main arm had the Helios ring delivering a bimatoprost agent. Finally, we have Replenish, which is a large refillable pump for glaucoma drugs that is placed under the conjunctiva with a small tube that goes into the anterior chamber. This can be refilled with a small syringe. In summary, depot drugs may improve adherence, and early studies show better tolerability against drops at least. The side effects may prove challenging to address and may require a test dose. The important thing is that it may need a comparison to the other long-term treatment, which is non-invasive, selective laser trabeculoplasty. Currently, there's been no mention of price as yet, or of any of the permanent change that may occur to the ocular anatomy or physiology. Thank you.